What is the menopause? The word the menopause actually means the last period, and often the focus is on periods and at what time, at what stage do they stop. But what is really important is to understand the process that goes on leading up to periods stopping. So the reasons that we have periods is that our ovaries produce an egg, release an egg each month, and produce hormones which fluctuate during a normal monthly cycle. These hormones are estrogen and progesterone, and as the levels fluctuate, they have an effect on the lining of the womb, which cause it to be thickened and in preparation for receiving a fertilized egg and hence pregnancy. But if an egg is not received, the lining of the womb is then shed. So the underlying part that's causing periods and then leads to period stopping is the function of the ovaries. As our ovaries become a little older, we have a change in quality of the egg cells and a change in these hormonal cycles, and finally we reach a stage when our egg cells are so small in number and the quality is so poor that the normal cycle doesn't occur. In that situation, the ovaries produce very low levels of estrogen, and so the lining of the womb isn't stimulated and periods stop. The average age of the menopause in women in the UK is around about the age of 51, but we know that it can happen later and it can happen earlier. And we also know that some women will also go through what we know as the menopause, in that they will have symptoms of the menopause, but this may be related to other reasons. So the natural menopause is when the ovaries run out of eggs, but an induced menopause means that the ovaries have either stopped working due to treatment such as chemotherapy or radiotherapy or other medications that can suppress the function of the ovaries, or surgery may in fact remove the ovaries. But the end result for all these types of menopause is that we become low on estrogen. What I'll describe in another clip is the consequences of becoming low in estrogen, and then what we can do if we want to think about treatments for the consequences.